Today we will discuss histology of the urinary system. Histology of urinary system. Now what is urinary system? Urinary system is those system which deals with the production of urine, its transport, its storage and the exit from the body. Its production is done by the kidney. Kidney and the transport is done by the ureter, the storage is in urinary bladder and the exit by the urethra. Now the production department is again divided into two, that is the excretory part and the collecting part. Renal production, urine production, it is divided into the excretory part and the collecting part. From bowman capsule, can say renal corpuscles, then to proximal convoluted tubule, then to loop of Henle, then to distal convoluted tubule, then to the collecting tubule. Up to this much is the excretory part. And from the collecting duct onward, that is collecting duct, and then it is also known as duct of Bellini or papillary duct, then to minor calyces, then to major calyces, come to renal sinuses, renal pelvis. Up to this much is the collecting part. Excretory part, it is developed from the metanephric blastema, whereas the collecting part is derived from the ureteric bud. Both is intermediate mesoderm. Now the structural and functional unit of the excretory part is the nephron. Nephron is, whole of this is collectively known as nephron. Okay. Now renal corpuscle, it is made up of bowman capsule plus glomerulus. Glomerulus is the afferent arteriole plus the glomerular capillaries plus efferent arteriole. This is called glomerulus. Okay, it deals with the filtration of blood. Then come proximal convoluted tubule. Here the 75% of the water and electrolyte, that is sodium, potassium and chloride, it is reabsorbed. Our GFR, that is the glomerular filtration rate, is 125 milliliter per minute, and out of which 124 ml is reabsorbed again. Only 1 milliliter per minute is excreted finally. So it is mainly done by the proximal convoluted tubule. Loop of Henle, it is known for the increasing osmotic gradient for the counter current multiplier system. Is also it reabsorb the water. Now come to the distal convoluted tubule. D, old, just memorize old. It works in presence of aldosterone and it deals with the acid-base balance. Collecting tubule, this is, it deals with collecting tubule, it deals with the it reabsorb water in presence of ADH. ADH mediated reabsorption of water done here. Okay. Now as a whole, we can memorize the function of the kidney is by water. That is, it deals with the water and electrolyte balance in the body. Now again, acid base balance, it eliminates the toxin from our body, that is the urea, creatinine and the nitrogenous waste. it produces the erythropoietin, which help in RBC production, and the R for the regulation of blood pressure through the renin angiotensin system, renin angiotensin aldosterone system. Okay, so the function of the kidney is water. Now come to the gross anatomy. It is located in the posterior abdominal wall, just at the level of L1, L2, L3 in the paravertebral gutter. From the midline, it is 2.5 centimeter is upper pole, then 5 centimeter hilum, and 7.5 centimeter lower pole. Such that its anterior surface faces laterally, and the upper pole is towards each other, like this. Okay. So it look just that the two persons are not seeing each other. They are दोनों एक दूसरे से रूठा हुआ है, बट उसका हेड एक दूसरे से सटने वाला है, अबाउट टू मीट. ओके, माना गुस्सा भी है और नहीं भी है गुस्सा. ठीक है, इस तरीके का पोजिशन. इट लाइज इन द paravertebral gutter, and this is reniform. Is length is 7.5 centimeter, is width is 5 centimeter, and thickness is 2.5 centimeter, and it is retroperitoneal, and it lies in the posterior abdominal wall at the level of L1, L2, L3, and it is covered from inside outward. It is covered by 4 layers. 3, 4. It is first is the renal capsule, then is the perirenal fat, third one is the renal fossa, and fourth is pararenal fat or perinephric fat. Renal capsule, it is adherent to the substance of kidney, but when we rub it easily scrap off. Okay, renal capsule. Then comes the perirenal fat. Perirenal fat is the brown adipose tissue which lies all around the kidney, even in the renal sinuses. Okay, within. Then third is the renal fossa, which is very much of clinical significance because it restricts the infection of kidney within its own territory. It has got 2 lamina, and the anterior lamina and the posterior lamina. Anterior lamina is known as the fossa of Girota, and the posterior is fossa of Zucker-Kandel. They envelop the kidney, then again it fused here, then again it depart, both lamina, and then encircle the suprarenal gland. Then again it unite and forms the conal fossa, which is continuous with the inferior surface of the diaphragm. This is the reason why the kidney moves with the respiration. Now, medially, kidney, suppose this is the medial aspect. The medially, it is this sheath is even enveloping the pelvis and the ureter, and then abdominal aorta and the inferior vena cava. Laterally, it is then both lamina unite and continues with the fossa transversalis. Inferiorly, both lamina are separate. This is very important point, that the both lamina are separate inferiorly. The posterior lamina is continuous with the fossa iliaca, and the anterior lamina is just intermingled with the connective tissue within the iliac fossa. And here the fourth one is the paranephric fat. Paranephric fat, it is a white adipose tissue which do not lie all over. It mainly lie the posteriorly and the inferiorly here, where this renal fossa is deficient. Not uniting, not deficient. It is not present here. And it holds the kidney in position, this pararenal fat. And this pararenal fat is used by the body during starvation and the nephrotosis occur. So it is of very clinical significance. Now come to the substance of kidney. Suppose if we took a longitudinal section of the kidney, what we see that there is the pyramidal shaped light stain, 8 to 10 in number. These are lightly stained. This is medulla, and it is surrounded by darkly stained granular. This is striated, pale stained or lightly stained, and plus striated appearance. And this is granular appearance and darkly stained. This is cortex. This is cortex and this is medulla. Now there are medullary rays which is insinuating the cortical matter, just like this. This is called medullary rays. It is nothing but the collecting duct, and it is also pale staining. Here is the dark staining, but pale staining structure as a straight line. It is infiltrating the cortical matter, and that is the collecting tubule. This is the collecting, here is the collecting tubule, this is collecting duct. Okay, and this is known as medullary rays, and it is the part of medulla. And in between the two medulla, there is the cortical matter are infiltrating, just like this. The cortical matter is continuous in between the two medulla. This is known as column of Bertin. Okay. Now look at the ductal system. What I have said earlier, that journey starts with the this is the renal bowman's capsule. This is glomerulus. Glomerulus is made up of efferent arteriole and the glomerular capillary and the efferent arteriole. This is the efferent arteriole, and this is the vascular system which forms the glomerulus, and this is the bowman capsule. This is bowman capsule, and here is the proximal convoluted tubule, which is highly convoluted and long. Then comes loop of Henle, which loop of Henle descend down in the medulla. There is upper zone, middle zone, and the inner zone in the medulla. When it traverses only the upper zone, this type of nephron is called the cortical nephron. And when the loop of Henle descend up to the inner zone of the medulla, then it is known as juxtamedullary nephron. Okay, and this type of juxtamedullary nephron, because it lies juxta, means nearby the medulla. Some nephron lies far away from the medulla, like here, and here the loop of Henle only goes up to the outer zone. But that type of nephron which enter up to the inner zone, they are lying at the just nearby the medulla, and that type of nephron is known as juxtamedullary nephron. Okay, so loop of Henle, then it forms the distal convoluted tubule which go up to the near the glomerulus, distal convoluted tubule, then collecting tubule. Now all the collecting tubule, there are about 1 million, more than 1 million. They are opening here in a duct that is known as collecting duct, a common duct, that is known as collecting duct or papillary duct or duct of Bellini. Okay, so there are many papillary duct opens here which is cupped by the minor calyces. Is the minor calyces, and many minor calyces there are 10 to 12 minor calyces, 10 to 15 minor calyces, and only for 7 to 8 major calyces, or only 4 to 5 major calyces. Okay, many minor calyces unite to form the major callus, and major callus open into the renal sinuses, and this is renal pelvis. Renal pelvis is up to the lower pole of the kidney, only here, and now it is renamed as ureter. Okay, so this is our ductal system. Now come to vascular system. The renal artery, it first become the segmental artery. There are 5 segmental artery according to the segment. That is it is divided into anterior and the posterior segment. Anterior segment again divided into apical, anterior superior, anterior inferior, and the inferior. And there is only one posterior segment. So total 5 segment is there, and there are 5 segmental artery. Now this artery runs in between the 2 medulla, and it is known as interlobar artery. Why lobar? Because the medulla and the nearby, just nearby this, up to this whole of this cortex, which is in a just by the side of that medulla, this is known as one renal lobe. This artery is interlobar artery because it lies in between the 2 renal lobe. And what is renal lobule? This one medullary rays along with the adjacent cortical matter, this is known as one renal lobule. So this is the interlobar artery. Then it makes an angle of 90 degree and now making arch, not making 90 degree angle, they are making arch and known as arcuate artery. Now they are making 90 degree angle and traverses in between the 2 renal lobules, such that this is one renal lobule, here is the one renal lobule, and in between these 2 the arcuate artery gives one branch, that is interlobular artery. This interlobular artery, now it enters within a bowman's capsule as the efferent arteriole. Now efferent arteriole, this efferent arteriole it gives branching and known as glomerular capillaries. Now efferent arteriole, and now here is the proximal convoluted tubule. So this efferent arteriole is now making a plexus around this proximal convoluted tubule and known as peritubular capillary plexus. This is very unique of this kidney because normally what happens, there is one capillary, the artery, arteriole, capillary, venule. This is the normal arrangement. But when 2 capillary system are just by one blood vessel, it may be an artery, or this blood vessel may be an artery or vein. And here is the capillary system and this is the capillary system. This type of arrangement is known as portal system. So here the adjoining part, the blood vessel, is the efferent arteriole. So this is the portal arterial system. Okay, portal venous system is found in the GIT, in which there is a GIT capillary, and then inside there is hepatic capillary, and they are united by the portal vein. So that is portal venous system, and as well as in the hypothalamus there is hypophyseal portal system. Okay, and here is the portal arterial system. So only in the peritubular capillary plexus is found only in the cortical nephron, because the proximal convoluted tubule, the all around here, but in the juxtamedullary nephron it just dipped down up to the inner zone. So here in this type of nephron, juxtamedullary nephron, they are not making peritubular capillary plexus. This efferent arteriole go along with the proximal convoluted tubule, a loop of Henle, and forms the vasa recta. Now this vasa recta convert into the stellate vein. Now this stellate vein opens into the interlobular vein. Interlobular vein opens into the arcuate vein. Arcuate vein now opens into the interlobar vein, because in between the two lobes, interlobar vein. Now interlobar vein opens into the segmental vein, and segmental vein into the renal vein. So this is the arterial and venous system, that is starts with the renal artery, then segmental artery, then interlobar artery, then arcuate artery, then interlobular artery, then efferent arteriole, glomerular capillary plexus, then efferent arteriole, then in the cortical nephron they are making peritubular capillary plexus, and juxtamedullary nephron they are forming vasa recta. After that vasa recta it forms the stellate vein, and stellate vein opens into the interlobular vein. Interlobular vein opens into the arcuate vein into the interlobar vein, then to segmental vein and the renal vein. This is the venous system, and ductal system I have already told. So these are the vascular and the ductal system. Now if we enlarge this structure, that what we see, that this is our bowman's capsule, this is bowman capsule, and this is the glomerular capillary. Okay, this bowman capsule has got, this is parietal layer and this is visceral layer. Parietal layer is made up of simple squamous, that simple means single layer, squamous means flattened cell. Okay, and this is made up of cuboidal type. Okay, and very specialized, not you can say cuboidal, you can say it podocyte. This visceral layer convert into a podocyte, in which it has got one body, and then primary process and again secondary process, like this. Their appendages, primary process, and then which give rise to secondary process. This is the primary process and this is the secondary process, and here is the nucleus. This is podocyte, which forms the visceral layer of the renal capsule. This is bowman capsule. Bowman capsule along with the glomerulus is known as renal capsule. Okay, and this is podocyte. And how the filtration occur? This filtration unit, it is made up of three layers, that is the glomerular capillary endothelium plus basement membrane, thick common basement membrane of capillary endothelium and the podocyte. And then third layer is the filtration slit of the podocyte. These podocytes are interdigitating, like our hand. If we put both our hand like this, fingers are just insinuating with each other, then but not completely. They are leaving some space in between, and this is known as the filtration slit, through which the blood is filtering. And how it is filtering? Because the efferent arteriole, this is the efferent arteriole, because it is coming, it has got wide bore. This is wide bore. Okay, and the efferent arteriole, this is narrow. So there is a high pressure system within the glomerular capillary, and which puts pressure, and this blood is filtering through the podocyte. And I have also tell that filtration unit, which is made up of 3 layers, and this is the podocyte. Okay, and there are the two type of barrier. There is size barrier, and the charge barrier. There are two things that there be low size, only low size will there is low molecular weight, less than the size should be near or equal to or less than albumin, and it should be positively charged. Negatively charged particle will not go by this pathway. So why not albumin then passes? Because albumin is negatively charged, so it can't pass through this. Okay, and what is the thickness? The filtration slit here is the this common basement membrane. This is of 100 nanometer thickness. Okay, and so the filtration, this the filtration slit is of the size of 25 nanometer, and the thick basement membrane its size is 100 nanometer thickness, and the capillary endothelium, which is highly fenestrated, and the one endothelial cell contain thousands of fenestration, and one fenestration is lumen is 70 to 100 nanometer width. This hole is aperture is fenestration is 70 to 100 nanometer diameter. Okay, and only the size should be equal or less than albumin, but albumin can't pass because it is negatively charged. Only positive charged particle will pass. Okay, so this is the reason behind it. And now this glomerular capillary is within a mesangial cell. In between this there is mesangial cell. This mesangial cell is also known as Poilkissen cell. It produces erythropoietin, also known as Lassis cell. Okay, and I have told earlier that the distal convoluted tubule come up to here. So this is distal convoluted tubule. Distal convoluted at the site of the glomerulus. It convert normally. What is the? It is cuboidal type normally, but when distal convoluted tubule passes through it is changed and it becomes tall columnar. This is known as macula densa. This is macula densa, and this is the efferent arteriole, which is coming. Efferent arteriole, the tunica media. Any arteriole has got tunica externa, media, and intima. Here the intima is disrupted. Intima has lost its identity, and then tunica media is in contact with the blood flow, and tunica media, here the tunica media is also differentiated into the granular, is filled with the granules, tunica media, and now this is known as granular cell or JG cell, Juxta glomerular cell, which contains renin. The granule is renin. Okay, and it become activated with the sympathetic innervation, as well as when there is low sodium concentration in the blood. It becomes activated, and then Lassis cell or mesangial cell, this and along with the macula densa, this form the juxtaglomerular apparatus, and there is renin secretion will be there, which promote the secretion of ADH. ADH will promote the and which is antidiuretic hormone. So it reduces the water excretion, or you can say it increases the water absorption through the distal convoluted tubule. Okay, distal convoluted tubule in the presence of aldosterone. Okay. So this is whole about the and how this blood pressure is maintained. When there is low sodium concentration, it comes into action, and this is known as urinary pole, and this is vascular pole. Now after this vascular pole, this is the proximal convoluted tubule, which is highly convoluted and very large in size, and if we took the section of this, what we see that this is simple cuboidal in nature and presents a microvilli towards the lumen. This is microvilli, and this is here is the nucleus, and there is a basolateral folding also, basal aspect as well as the lateral aspect. So enfolding of the membrane like this, and in between the enfolding, this is the here is the mitochondria. So many mitochondria is there, and it takes that's why it takes dark stain, and lumen is very short due to the presence of microvilli. And microvilli is like this, they are not towards one, not facing one side. It is brush border, it is like brush border like. Okay, now after that there is loop of Henle. Is the action of proximal convoluted tubule is to reabsorb the 75% of water and the sodium potassium chloride, and that is 75% of water and electrolyte reabsorption is done by proximal convoluted tubule. Then after that, loop of Henle comes. Loop of Henle, it is such that this is loop of Henle, and this is the descending limb, and this is the ascending limb. This is after the proximal convoluted tubule, and here is the distal convoluted tubule, and this is the loop of Henle, and here is the continuation of the proximal convoluted tubule, and it is thick segment. Here is the descending limb has got thick segment, and this is thin segment. It is, and now the ascending limb has got large thin segment and then short thick segment. Clear? The loop of Henle has got two limbs, descending limb and the ascending limb. Both limb has got thin segment and thick segment. The thick segment is more in descending limb, and the thick segment is less in the ascending limb. As the more is the thin segment. Okay, and the cells are simple cuboidal. Only difference is that it is not permeable to the water. That, but it presents a counter current multiplier system. This increasing with it deep down inside the medulla, and with the depth there is increasing osmotic gradient, and it presents a counter current multiplier system. After that, distal convoluted tubules comes. D for distal, old. Just memorize old. That in presence of aldosterone, it does acid bed balance. It takes one sodium ion and excrete one potassium or one H ion, and by this method it balances the acid base, this distal convoluted tubule, in presence of aldosterone. Then comes collecting tubule. Collecting tubule, it is also not permeable to water, but in presence of antidiuretic hormone, it absorbs water. So our GFR, glomerular filtration rate, is 125 ml per minute. But 124 ml, it is reabsorbed again. So net is the 1 milliliter per minute is excreted. And our total, there is 1500 ml per day urine is formed. Okay. And if we look the section of the distal convoluted tubule, and there is no microvilli, but there is basolateral folding will be there, and there will be less mitochondria. So and there is nucleus, and this is mitochondria. So this is pale stained. If we look the section of a kidney, this is the round. This is the renal corpuscle, which is made up of bowman, capsule, and the glomerulus. Okay, and here is the proximal convoluted tubule and the distal convoluted tubule. So proximal convoluted tubule, this is highly convoluted and more in length. So there are many proximal convoluted tubule, and they are flattened. Okay, they are flattened, and they are darkly stained. The cells are, and the lumen is very short due to the presence of microvilli, and there is round and less in number and pale stained. This is distal convoluted tubule, and this is proximal convoluted tubule. So what is the difference in between the two? Proximal convoluted tubule, they are somewhat more large and flattened, and the lumen is short due to the presence of microvilli. They are darkly stained due to the more mitochondria. And distal convoluted tubule, its lumen will be large because of the absence of the microvilli. They are pale stained due to the less mitochondria, and they are less in number because its length is short, and they are not so convoluted, so they are round. Okay, this is the difference. Now coming to the collecting tubule is and here what we are seeing, there is basolateral folding. There is no microvilli in the distal convoluted tubule, but there is basolateral folding. But in the collecting tubule and the collecting duct, even there is no basolateral folding. There is a distinct cell border will be there. This is also simple cuboidal. All are simple cuboidal, but there is distinct cell boundary, and also it is pale stained. Okay, because there is less mitochondria within also. So this is the histology and the everything is matters now. This is the now collecting tubule. They are all gathered to form the collecting duct, and this is the papillary duct and duct of Bellini, which opens into the minor calyces, then to major calyx, then to renal sinus, and then to renal pelvis. So this is all about the histology of the urinary system. Thank you.